Wonderful. So I call this a landscape survey because there is a lot of confusion about what BioXTech is. So I'm going to try to clarify that. Hopefully through the next hour or so, you're going to get a good idea of what happens in the real world at the intersection between biology and technology. And then that hopefully maybe will have an impact on what you decide to do in college, what do you decide to do as far as your career goes. Okay. So a little bit about myself. My undergrad was pretty much in electrical engineering, but I'm really interested in life sciences and healthcare, so I kind of switched to bioengineering in my graduate studies so that I can apply my engineering skills in fields that I feel more passionate about. So that's how I got into this field. Now, as far as my actual studies in my graduate work, it is to study a molecule and how it behaves in cells, in live cells. And what does it do? How does it interact with other machinery within, a live cell? But in order to do so, that's the biology part. The engineering part then is I had to build my own instruments. A lot of it has to do with optics, automation, and then using software to run the instruments and using software to interpret the data. So that's the engineering part of what I did. So throughout today's conversation, you'll see I may have a tilt towards that side of the BioXTech space. Now, one of the things I will say is that having had exposure to both biology and technology and engineering had been really helpful for my career, right? I may or may not be really doing bioengineering now, but being able to understand and speak to both sides of this divide, being able to have a conversation with customers who are doctors, who are scientists, or who are engineers and bring them together, that is extremely helpful. That certainly helped me. So as far as today's conversation goes, the more you can get out of this, the better. And then we'll see what it can do for you. Hopefully a lot in the next few years. So one of the things I've always been interested in is at the intersection between biology and technology. But I'm clearly not the only one who's interested in that. When I was reading Steve Jobs' biography several years ago now, and this caught my attention. And he says, I think the biggest innovations of the 21st century will be at the intersection of biology and technology. A new era is beginning. Right? Now, he's certainly not the only visionary who had this type of a conviction. Right? We will talk about Elon Musk a little later. He's clearly a believer in this space as well. So that gets us to, this intersection really is what BioXTech is all about. It's biology crossed with technology, okay? So, some ask me, what does biotech come into play? Is biotech, BioXTech, what's the difference, right? Well, biotech, as we understand it now, is really a subset of BioXTech. It's at the intersection of biomedicine and technology. But in the next 30, 40 minutes, you will see the space is much, much larger than just what we consider biotech, okay? So then for the rest of today, we're gonna focus on what the heck is going on here in this intersection, all right? But before we answer the question, what's going on in this space, I feel we need to get some definitions cleared up so that we are all on the same page. What does it mean to be at the intersection of biology and technology? Let's define a few things, okay? There are slightly different definitions here and there, but I'm taking the following definitions, which I consider fairly practical. First of all, what is biology? Simple, right? Biology is the science of life and living organisms. We understand what life is. We understand what living organisms are. But what is science? Right? So then you have to define science. Science is the systematic study of nature based on the scientific method. So science is more about the method than anything else. Okay? So we know what study of nature is, then we have to define what is the scientific method. The scientific method, you've all studied that, you're all good students. It really starts with observation. You see something, you have a question, something intrigues you, then you have a hypothesis of how that thing works. But the hypothesis by itself is not very useful, so you test it with objective experiments to gather data, and with that data, you analyze that data to see, is the data consistent with my hypothesis or not, right? And if it's not consistent, I have to change my hypothesis. If it is consistent, then often I have additional questions that comes out of that. And then the cycle repeats itself. That's how we understand more and more about nature, and specifically in the context of today's discussion about biology. Okay. There are methods that's not scientific, right? I mean, the scientific method is a relatively recent thing. So science is not everything, but as far as we're concerned here, everything we do is around scientific methods. Then what is technology? Technology then is the application of scientific knowledge as a repeatable solution for practical purposes. Keywords are repeatable and practical. Okay. And then what is engineering? Engineering then is using existing technology or invent new ones to solve a specific problem. Oftentimes, an engineering task is combination of many existing technology. So technology must be repeatable because you can apply this technology here, you can apply this technology in another engineering project, right? So that is the foundational definition that everything else will be built upon, okay? Now, this may be still a little bit fuzzy. So I'm gonna give you 3 examples of science and technology, how they relate. The first example is, this is one of the first documented view of neurons. This is around the turn of the century, 20th century, so turn of the century, so 100-some years ago, right? So from this humble beginning, this is an observation of neurons, right? We started to go through the scientific method, and we now understand a lot about how neurons work, okay? With this understanding, then, we invented a new technology, and that is the computer neural network, okay? So a computer neural network, then, is a form of artificial intelligence, but it's inspired by the scientific understanding of how biological neural network works. So with an understanding of the computer neural network, then somebody put together this machine, which is an engineering marvel, that is the first machine that realizes a computer neural network. This is, you may or may not be able to see, but there are a lot of wires here. It's a very big machine. It probably does very little because it's the first one. Now, over the last several tens of years, we've optimized this machine to the level where AlphaGo, which is an artificial intelligence neural network machine, playing the game of Go, beat the world champion handedly. Okay, when the artificial intelligence community, when the machine first beat a human player in chess, this was, I don't know, 20 years ago maybe, the estimate was it would take another 100 years to beat human players in the game of Go. because Go allegedly requires intuition and computers can't deal with intuition. But it happened a lot faster. Computers are, I guess, as good at intuition, in quotes, in the game of Go as humans. It not only beat the best human players, it devastated the best human players. This fellow here was the immediate former world champion, and he was beat by the computer, and he was so devastated he quit the game. He's like, what is the point of playing? There's no way that we can ever win against the computer. So that is an example of something from a observation, going through the scientific process, develop a technology through engineering to implement the technology, and then iteratively improving on it. That makes it a very, very powerful technology that you can be used everywhere. Artificial neural network, I will give you examples, will be used in medicine, is used in medicine now, in addition to playing games. Okay, so that's one example. Here's another example. I know CRISPR is a big deal, right? A lot of people are very interested in CRISPRs. So CRISPR technology started out by a team of researchers observing that there are these repeating patterns in a bacterial genome. Don't know why. So they couldn't think of why, so they kind of put it aside. You know, some years later, another team observed the same pattern in a totally unrelated organism, right? Then it becomes really interesting if two different organisms that are evolutionarily very distant, meaning they're not inheriting one from the other, so they're very distant. If they kept the same thing, chances are that thing is valuable. Otherwise, evolution doesn't really carry a lot of, you know, useless things around for that long of a period of time. So, and then over time, somebody of all places in a yogurt factory figured out that, you know, what does CRISPR do? CRISPR actually helps bacteria fight off viruses, right? Because their yogurts were spoiling because of viral infection. Some of them don't. It turns out they leverage CRISPR to fight off the viral infection. And over again, incremental improvements after incremental improvements, and then two ladies figured out the last pieces, and they were able to assemble the whole machinery of CRISPR in a test tube, and they won Nobel Prize for it in 2020, right? And by then, I'd say that has made CRISPR a technology, and that technology is repeatable, it's practical. A lot of use cases came out of that, including applying CRISPR in human cells, and there are, you know, therapies in clinical trials or earlier research trying to fix genetic mistakes in humans, right? So that's another journey from observation going through scientific method to technology to applications. Now, one of the telltale signs of something becoming technology is if you can buy it, okay? This is a package that helps you do CRISPR. So if you can buy something, that means it's repeatable, and that means it's practical, it's useful, otherwise nobody will pay for it, right? So that's another example. A third example I will give you, last example, is you've seen this picture. Most of us have done this already. This is when you get tested for COVID, okay? COVID testing is through PCR. Okay, so PCR is a very well-established technology. There are machines that do PCR for you. There are reagents, that everything you need to process the samples that you acquired from here, and there's software to help you interpret. So that is a very well-established technology. But behind this technology, what happens? It's PCRs, right? Polymerase chain reaction. What does PCR do? It amplifies, in this case, you know, viral genetic material. It happens to be RNA, but similarly, you know, in an exponential fashion, right? So 1 becomes 2, 2 becomes 4, 4 becomes 8, and so on. And if you amplify it 30 times, you get 1 billion from 1. So that's the power of exponential amplification. By the way, slight digression. if you observe anything exponential, it's interesting. It's either going to be devastating, like a bomb, a nuclear bomb or any kind of bomb is an exponential process, or something like this where you have very little of something and then you can get to a lot of it so that you can make a decision on very quickly. Now, there is a lot of technology that went into PCR. I won't go over all of them, but I'm going to highlight one technology, which is the tech polymerase, which is the thing that does the copying, right? So if you don't have something to copy the DNA, you're not going to have PCR. The only problem with copying the DNA is that once you made a copy, you have to separate them, separate the two strands, then you make a copy of each strand. That's how you get exponential growth. And the problem with that is when you separate the two strands, you have to raise the temperature in order to separate the two strands. Okay. But the problem with that is if you raise the temperature, you kill the polymerase. So in the olden days, every cycle of this, you have to add new polymerase into it. Because when you raise the temperature, the old polymerase you added into the test tube is dead. Okay, until somebody started to use a heat-resistant polymerase, a polymerase that doesn't get bothered by temperature going up. So when the temperature goes high enough, it separates the two strands, but the polymerase is still okay, so it just starts copying both strands, and you repeat that. So how did we get to know about heat-resistant polymerase? Here, this is 60-some years ago. This fellow, Dr. Brock, Thomas Brock, collected a sample from a hot spring, basically, in Yellowstone, because he knew there are things growing in this hot spring because the hot spring actually turns different colors and so on. And that's interesting, right? Why would something grow at such high temperature? Because people didn't think organisms can grow at such high temperature. You can see the steam here even. So from that collection, over time, he was able to isolate the tech polymerase, which then over time become one of the input technologies to make polymerase chain reaction happen. Right? So again, from observation to scientific research to engineering to then a technology that can be used repeatedly. All right, I'm going to pause here. So that's kind of the background. Then I'm going to go into what is actually happening in the BioXTech space. I see there's 2 chats. Any questions so far, or should I continue? All right, I'll take that as a no, I should continue. All right, so the question is, what's going on at the BioXTech intersection? So the way I'm answering this question, my methodology is I went to the top institutions that actually play in this intersection. Now, if you look at college majors, the closest to BioXTech is really biomedical engineering and bioengineering. So I looked up the top institutions. Number 1 is actually right in our neighborhood, Johns Hopkins, in bioengineering and biomedical engineering. I said, okay, what are all the research areas in the top schools, and what are the intersections of these top schools? So I listed some of these intersections. Now, the space is vast, as you can imagine. I'm leaving a lot out of this space, but I'm going to talk about these 5 areas, okay? And mostly through pictures and stories and graphs, just to give you a sense. Now, if you're interested in anything, we can do a deep dive. We can invite other experts to do a deep dive. All right, I'm just going to go through them. First one is computational technology application in biology and medicine. Under this umbrella, one of the interesting development is what's referred to as systems biology. Okay? And Now, science, in a large part, has adopted the reductionist approach. So I have this arrow here from reductionism to systems biology. What is reductionism? Reductionism is to say that when I have a question about a complex system, I'm going to break it up and try to understand individual pieces of the system. If I understand the individual pieces of the system, I can more or less understand the system. It'll at least help me understand the system. For example, if an alien looks at a car, okay, and then it says, oh, the car has an engine that provides the energy to move. It has wheels that turns, that moves it on the ground. It has brakes to stop it from moving. It has an accelerator. It has, a spring that, makes it a smoother ride, and so on and so forth. Right? So if you understand the pieces, if you reduce the whole into pieces that you can more easily understand, and then with that understand the whole, that's the reductionism approach. Okay, so when you try to understand the life process, you isolate individual proteins, you isolate DNA, that's all reductionist. However, once you understood the parts, it's not necessarily easy to understand the whole system, because properties of the parts don't always necessarily translate into properties of the whole. So that's where systems biology comes into play. So system biology then takes another view from top down to say, what if I look at all the parts together and see how they work, right? And in order to put them all together, it almost by definition, you're going to need math, because math is what will connect all the pieces together, right? So system biology is a computational application into biology and medicine. So that's just one example, okay? So it involves mathematical modeling and simulation of biological processes. And another application of computational technology in biology is artificial intelligence. We've already mentioned, neural network is a form of artificial intelligence. But AI in biology and healthcare is very hot now, especially the first three aspects, right? Helping with disease diagnosis, detection, improve decision making, and once you have better decisions, you can help to aid treatment. I'll give you a couple of examples. A lot of the detection is image-based, right? For example, here is a brain scan, or actually, I don't know, it's some kind of scan. Actually, I don't think it's a brain, it's part of your body. So you can, using computer AI algorithm to tell you what might be cancerous, what might be not, right? So that's static. If you have temporal information, even better. This is a mammogram where if you look at an image 4 years ago, the computer was able to identify there is a potential for cancer growing in this region. And 4 years later, there is actually a tumor growing in this region. So now this is all done retrospectively, meaning, the computer didn't do this 4 years before. It actually went back 4 years to look at the mammogram from 4 years ago and said, okay, using my algorithm, could I have detected cancerous regions potentially? And the answer was what? Was yes in this case. So imagine if this is part of our routine screening and we can detect cancer early, there's a tremendous value in doing that, obviously. So that's a couple of examples of computational technology application. Another area is biomaterials and tissue engineering, and often involving immune engineering, because if you put anything into human bodies, you need to deal with the immunological reactions to human bodies. This is an artificial liver. So what's interesting here is that it has a gel-like matrix, which is a space for several different types of cells that normally grow in livers to grow in this little gel matrix. Now, the research team found that if you just only grow one type of cell, it doesn't really do what liver does. You have to, first study what's in the liver, what cell types are in the liver, how do they interact with each other, and then you try to reassemble it artificially into an artificial liver. Okay, and they were able to make this artificial liver do a lot of things, not all the things, but a lot of the things that normal livers do. It's not quite ready to be implanted back into humans yet, but you can use this artificial liver to test drugs, for example, to make sure they're not toxic. So toxicity testing, for example. So I thought that was, tissue engineering was pretty exciting. And here, it's an artificial badge that is used for wound healing. Now, when you have a small cut, it just heals itself, no big deal. But a lot of times, worse wounds may be difficult to heal, or if you have some base disease like diabetes, wound healing is a big deal. Now, in this case, this group basically made a bandage that has sensors on it, and the sensor would tell a controller, which stage of wound healing is happening, and at that stage, what drugs are necessary to help with it, so that it can be more intelligent in helping wound healing. So I found this useful and interesting in terms of the electronics, the sensors, and the biology of wound healing all coming together to make this happen. Now this, you've probably seen this type of graph. This is an mRNA vaccines, right? So a lot of us probably had the shot. And mRNA vaccines is a major engineering marvel, right? So it's not easy to have foreign mRNAs or any other molecule to function inside of your body. So there's immune response involved, how you package it, how do you have this little lipid bubble basically, package the payload, how long are they going to survive in the body, how are they going to be utilized by the machinery to make the antibodies and so on and so forth, right? So that's a pretty impressive advancement in vaccine production. I'm interested in nanotechnology as well. So here's an example of how nanotechnology is applied in medicine. In this case, let's start from here. So if you have some nanoparticles that you just inject into the bloodstream, and then as the nanoparticles go through the blood vessels and enter the tumor cells, you can either somehow target the nanoparticle to accumulate in tumor cells, or a lot of times just by the nature of tumor cells, they are more porous. They have a lot of malformed blood vessels. The particles are just more naturally, easily accumulate in tumor cells. Okay, and after they accumulate, you use infrared lasers to shine on the tumor, and then they get really hot because these particles are designed to absorb infrared and really produce a lot of heat. And you basically bake the tumor to death in a sense. All right, you can think of it that way. And then they die either programmed cell death or necrosis. Here's an example. These two pictures are actually from my PhD advisor's work. So he's working on something similar to this, where he's using gold nano rods. It's 12 nanometers by 45 nanometers. And if you infuse this into an experimental mouse model, where here mouse had tumor and over time tumor disappeared, right, through this mechanism. There's a lot of work. There can be a lot of different materials, different ways to target, different activation methodologies. Nanotechnology can be really interesting in a lot of areas. All right. Another area is imaging devices, biosensors, instrumentation. So now you can have image-guided surgery. right? That's pretty routine now in healthcare. You have robots. This robot is called the Da Vinci. I believe it's the first FDA-approved laparoscopic surgery robot, meaning minimally invasive surgery conducted by robots. What's really interesting about this robot, this approach, is that surgeons don't pick up the knife anymore, right? Traditionally, you think of surgeons, you think of them using knife to cut you open. Not anymore. What they do is this is how they do surgery. They use joysticks. Everything is a game now. It's like playing a game. So the surgeons do this here, and these robots then actually performs the surgery on the patient. So I thought that was very cool. This is an ingestible device. You swallow it, right? You can tell how big it is. It's like a pill size. So rather than having big tubes, stuck into your throat, or the other way around, which is not a lot of fun, you just swallow a pill effectively, right? And this pill then has a lot of sensors on it. It can detect whether you have any issues, beginning to end in your digestive tract. There are also teams that are studying or experimenting with not only sensors detecting, but also actuators, meaning it can actually intervene. For example, maybe if you see a bleeding, you can actually go and nip on it and stop the bleeding, or apply some medicine to stop the bleeding, right? So little sensors like this in your body in the future, perhaps not only in the digestive system, but in your blood vessels and so on, is going to be very, very useful. Certainly makes quality of life better in diagnosis. I said that in my own work, I did some instrumentation. So what does that mean? So this is an instrument, right? It's called an atomic force microscope. What it does is that it gives you images like this. Note that this is 5 nanometers, meaning it's tiny at the atomic level. Each bump is like an atom here. So this is a membrane channel. It's a membrane channel that connects two cells. When two cells get together, at the intersection, there are channels. These are the channels when they are open. These are the channels when they're closed. So these are pictures from an instrument like this, right? With this type of resolution, with this type of understanding, it helps us, be more productive in our research into biological processes. But it requires, technology and engineering skills to be able to do so. Okay. All right. This is a topic that is absolutely fascinating, neuroengineering. It can either be fascinating or scary, depending on your perspective. So 30-some years ago, 1990 is when I got into graduate school. The first class I ever took was about cochlear implant. Okay, so what is cochlear implant? It's an implant in your ear that helps the deaf hear. Okay, so a lot of times deafness is because the mechanical part of the ear, right? So you hear. What does it mean to hear? You hear by sensing the vibration of air, right? And you turn that vibration, mechanical vibration of air, into an electrical signal, which then goes up through nerve endings into your brain. That's how you hear. But if the mechanical part of your ear is bad somehow, either the membrane is bad or what's referred to as a hair cell, the hair cell vibrates, which creates the electrical signal, is bad, then you can't hear. A cochlear implant, which is probably one of the more mature neuroengineering devices, it senses the vibration and creates an electrical signal, and that electrical signal is coupled to your nerve to help you hear. Okay, so I watched a movie where this little baby heard for the first time, and as she heard something, she looked up to her mom, and I did a screen capture of this picture, and I thought that was a great moment for BioXTech, right? Because from a my own perspective, I'm in this space because it's meaningful. I'm in this space because what I do touches human, touches, I mean, imagine this baby being able to hear versus not for the rest of her life. That's very, very meaningful. That's why it's such an attractive space. Okay, some other examples. Imaging is a big thing. You've seen imaging across several of the spaces, right, that I mentioned already, and there will be more. So being able to look into the brain and see what's going on in the brain is really the next frontier. My opinion is that if you think about pharmaceutical waves of pharmaceutical progress, years ago it was cardiology was a big wave, right? All the statin drugs that helps lower your cholesterol, that was big advancement in cardiology from a pharmaceutical perspective. In the past 10 or so years, it's oncology. There are a lot of new cancer drugs that have come out. Cancer survival rate has been increasing. I think the next frontier is really the brain, the neural side of things, okay? So you can use various imaging approaches to look for structural changes of the brain and functional changes of the brain, right? So you can use that to study trauma. You can use that to study, mental diseases. You can use that. I've read some things about, using this type of technology to study people who meditate, right? So a lot of potential in brain imaging. But imaging is just to detect, right? You can also intervene. So this is a picture of a probe in your brain. If you have Parkinson's disease that you can't stop shaking, you can stimulate the right parts of the brain to help you manage symptoms. Okay. So another fascinating area is prosthetics, smart prosthetics that are tied directly connected to your nerves so that you can control your prosthetics without, much better than the old, the pirate's leg type of prosthetics, right? So very, very interesting areas. I would love to know more about this space. I feel you guys should invite some guest speakers just to talk about prosthetics. Okay. Now, a subset of neuroengineering, which is scary and fascinating, is called brain-machine interface. Okay. We all know Elon Musk as somebody who created Tesla, electric cars, sending people to space. But he also is heavily involved in a company called Neuralink that is transplanting a little device like this into your brain to help with all kinds of brain issues. All right. The way he puts it is it's like a Fitbit in your skull with tiny wires. So what this thing does is it has a central controller, but 1,024 little wires that you can implant into different regions of the brain. Okay, those of you who have studied computer know why it's 1,024, not 1,000, not 1,050, 1,024. Okay, so what's interesting is that they're now saying that this literally came out in the past week or so. Okay, they're hiring a clinical trial director, which means they're probably getting pretty close to human trials. They've implanted this into pigs, and it turned out to be fairly safe. The pig was just doing its thing, pretty happy. So now they're doing it, they're going to be doing it in humans. So what are they going to do? So imagine a specific case. I think this is what they're going to do in their clinical trials. If somebody had a spinal injury, so that that person can think perfectly, but he can't move his limbs. Okay, so a hypothetical application of this type of device is you implant this little device into your skull, and you have probes into different regions of your brain. And when you think about, I want to move my right leg, those probes will detect neural signals. And through artificial intelligence, you're going to train the computer to say, hey, this type of signal means I want to move my right leg. Okay? Now imagine there's another device, this time not in the skull, but in your spine, after the point where you had injury. Okay? And that device has probes, and the probes that are not to detect signal, but to send signal. Similarly, you use artificial intelligence, you figure out what pattern of signal means to move the leg. So you take the signal from the skull, from inside of your brain, thinking I want to move my leg, transfer it to another sensor actuator to stimulate the nerves in your spine to actually move your legs, right? So this is why I quoted Arthur Clarke, any sufficiently advanced technology is indistinguishable from magic. This is magic, right? It's not quite raising the dead, but curing the limb, I guess, right? So this is why it's so fascinating, but also scary, depending on how you think about it. Sky is the limit for what potential there is for neuroengineering, right? I see there may be some questions. Let me see that. All right. Elon Musk is not the only one who's doing this type of work. In fact, DARPA, which is Defense Advanced Research Projects Agency, DARPA has large projects that they support in this space. Now, you may or may not know about DARPA, but DARPA is what supported the internet effectively. So internet came from something called ARPANET, and ARPANET is supported by DARPA. So you could say DARPA is really what is behind the internet. Now DARPA is also behind brain-machine interface. I looked at some of the projects that DARPA supports. One of them jumped out at me. So what this project is that I think this is a team in Brown University. They're making these neural grains, right? It's like a grain of sand. It's about 1/10 of a millimeter. This is your finger, right? These are little grains called neural grains. Think of them as mini computers with ability to communicate and actuate. So they can sense and they can send signals to the brain, right? So imagine you have thousands of these, maybe even more, little sands, grains in your brain, strategically located, and they're able to communicate, and you're able to ask it to do things, right? So it's kind of the futuristic version of what you just looked at in terms of the Elon Musk's device. So you can really take over the neurological process. You can help with neurological diseases like I described. And then what's much more controversial is, can I use this not only to cure diseases, but to enhance humans, right? Now that is a very large topic. If you're interested, if we have time, we can talk about that. But it's very controversial, as you can see. It could be philosophical. It gets really to the question of what is a human, right? Now, I have a lot of very strong opinions in that space, but it's very, it's a controversial, but to me, a really exciting space that we have to face. We can't be, hiding our head in the sand and not facing the possibility of these types of technologies coming into existence. One of the last things I will talk about is cardiovascular engineering. This is, again, is one of the earlier BioXTech success stories. Right? You've probably all heard of pacemakers. Right? Pacemaker is just a device that senses that your heart is not beating correctly, and it sends an electrical signal to force your heart to beat synchronously. Right? And this is an X-ray of an implanted pacemaker. So that's one device that's been around for a long time. And then another way the heart can go wrong is the valves, right? So the blood can go one way, not the other, and so on. So there are all kinds of valves that have been created and tested and used in humans. That's another success story. More recently, stents if you have coronary artery diseases, your arteries are clogged. Well, you can use stents to in this case, it's a metal mesh balloon that blows out and unclogs your artery. So those are all very much success stories in cardiovascular engineering. But it doesn't stop there. You've seen this picture. It's an iWatch that is used as a cardiac monitoring device. Right? So more and more there are wearable devices that help to monitor your health. But one of the things that's unique about cardiac system is that cardiac muscles don't regenerate. By and large, they don't regenerate. Right? So if you have a heart attack, a patch of your cardiac muscle dies, they're not going to fix themselves, which means over time, if you have more and more muscles die, your heart won't work anymore, then you may need an artificial heart. Okay? So can we grow artificial heart? Can we grow artificial heart tissues that we can use to fix broken heart, like literally broken heart, right? And there has been a lot of work done in this space. This is a picture where you're growing beating heart muscle in a petri dish. So theoretically, it's possible to create tissues that function like heart, right? And the holy grail is to grow artificial heart. This is an artificial heart. It has all the right types of tissues and blood vessels and so on. It's actually 3D printed, right? So you print layer by layer different cell types and then have it onto a scaffold and then let them grow into an artificial heart that is anatomically and cell-wise consistent with real heart. So this heart, I believe, from what I read, it does beat, but it doesn't beat like a real heart yet. So there's a lot more work to do. But imagine being able to 3D print a functional heart. Maybe use your own cells so that you don't have immune rejection problems, and then put it into your body. So to me, that's exciting prospect.